Today we're diving into an important topic that often doesn't get the attention it deserves: men's health. As we know, across many communities, men are less likely to visit a doctor, talk about their health concerns, or seek help early. Whether it's physical health, mental well-being, or preventative care, this reluctance can lead to serious conditions going unnoticed until they become much harder to treat. Today we're joined by GP Peter Lovass, who works closely with patients across a wide range of health issues affecting men at different stages of life. Together we'll explore why men's health matters, the common barriers that stop men from seeking care, and the simple steps that can make a real difference in long-term well-being. Welcome to Monday Matters. I'm Ian Bunston. Well, welcome, Peter. Lovely to have you as our guest today.
Thank you, Ian, and thank you for all of your listeners. It's a pleasure to be here.
Peter, if you could tell every man that's listening this morning an uncomfortable truth about their health, what do you think it would be?
Well, what a way to start. Look, I think the uncomfortable truth is that weight is probably the single biggest driver for a lot of our health concerns as we get older. And the uncomfortable truth is that in Australia, like lots of westernized countries, we're getting up to about 75 to 80% of men are actually overweight or obese. It's a problem all through the lifespan, from our children, our grandchildren, all the way through. But that would be an uncomfortable truth.
Now, I've also got to add in another question for you. I do believe there are times when a man fronts up to the doctor, but with his wife. But it's often the wife that does most of the talking. What do you think about that situation? Do you experience that?
All the time. And in fact, I do welcome it. I think the insight you get from any family member, whether the wife, but also the husband coming to the wife's appointment, is really a telling situation, because you get the truth out of the person, or you get the story out of the person, and then you kind of just look sideways and say, what do you reckon's going on? And for someone who's spent, day after day after day with someone for years and years, they're obviously a wonderful source of information. So it's a good thing. It's a good thing. I welcome it.
So, Peter, why do you think men delay seeking medical or mental health support? And how do you think we can change that culture?
Yeah, it's a really important point to raise, Ian, because I think there's plenty of evidence to suggest that men do delay seeking help for their concerns, and much more so than women, for sure. The evidence shows that, and I think there's probably many reasons for it. And I guess I would be interested to learn from you as well about what the reasons would be, whether it's embarrassment or concern about what they might find out, or whether it's a more practical issue like time or effort or finances. But in my mind, what I see is probably just not prioritizing health. Not We spend so much of our time thinking about other things and planning and preparing for the future. But unless you prioritize planning for good health, the rest of it's all a little bit immaterial. So I think a lack of prioritization would be the issue.
Okay, so earlier we mentioned about the issue of weight, but let's go a bit further. What are the most overlooked health risks, do you think, facing men today, say both physically and mentally?
Yeah, we often use the acronym SNAP as being a good description of the lifestyle factors. So SNAP stands for smoking, nutrition, alcohol, and physical activity. And that's a really neat way for us as doctors to think about screening for your health. So I think these days smoking rates are far down, which is a wonderful success. Sadly, though, the vaping industry came in under our notice. Nutrition's a big one, both in terms of choices and quantities of food. Alcohol is probably the number one drug that we're concerned about worldwide, and a lack of physical activity. So they're probably the four areas that we focus on. But in terms of disease processes, the big three are really the big clumps of things like cardiovascular disease, which is heart disease and stroke, um, cancer, and mental health. They're probably the three major areas that when I see someone for a health checkup, I'm focusing on where are people at in terms of their risk, what can we do to reduce that risk or address those risks. They're probably the three main areas that I get involved in all the time.
So, Peter, going even a bit further, how do factors like, say, for instance, work pressure or maybe social expectations, loneliness, and also generally speaking, I think that men tend to watch the news and current affairs more, and so this can be add to concerns and worries, and maybe even contribute towards depression. How can these things affect men's long-term health, do you think?
Oh, look, I think that has a huge role to play. And that's where there is this distinct advantage of knowing your patient and knowing their circumstances, knowing about their family, having seen them for a long time so you can follow up what's happening in their life. And yes, by having their spouse or loved one or family or children, grandchildren coming in with them to give you that context because it's so important. So, of course, we are all a product of multiple factors, our innate wellness and our fitness and our life choices, but also our circumstances. So, at one extreme, loneliness and isolation or home insecurity or job insecurity or financial pressures, they clearly have a major, major impact upon access to health, but also the types of factors we talked about previously with the SNAP factors being a lot more of an issue in people under duress. Loneliness, in the most connected age that we're in through the internet and services like even what we're doing today, rates of loneliness have skyrocketed. We are feeling more alone than we ever have before. And this does play into our emotional health, and our emotional health, of course, interacts with our physical health and well-being. So it's a really important point to raise. It is absolutely central, the context that the person is in, and then the influence on their health choices, their lifestyle choices, their focus and the ability to focus on their health. That is all part of the mix and part of the complexity of us as human beings.
Mm. And do you think, just going back to, say, watching the news, say,
Mm.
rather than the once during the day, but sometimes men do watch it several times. Do you think that's impacting their health?
Yeah, I think it often does. And I think all of us are made to be empathic people. We feel, we try and identify with what we see and what we hear. What would that be like if it was me, or one of my loved ones? So there's this fine balance, isn't there, between being informed and aware of what's going on. We are a citizen of the world, and yet um, also sort of, yeah, limiting, I guess, being mindful of how much media we consume. We've got it at our fingertips 24 hours a day, 7 days a week. So I guess my advice would be to stay informed, stay aware, make sure your what you're seeing, what you're hearing is legitimate, because that's another whole area, isn't it, of computer algorithms and what type of news is fed to us and views that are fed to us. And at the same time, switching off the screen, getting outside, going for a walk, interacting with people, is so important as well, because I think a lot of us get driven into senses of anxiety and worry by what we see and what we hear, not without reason, but it's something to be aware of and to address, I think, as well.
Mm. Now, you've touched on an interesting point. I'm just thinking, going back a step, how when people come to the doctor, there'll be an ailment, some condition, and then often a drug can be prescribed to assist them in that area. But if we move to another area of social prescription, where a GP or a doctor is able to prescribe a social, situation, how do you feel about that? Because you mentioned about getting as simple as getting out for a walk, getting out with a group, connecting. What do you think?
Oh, I think it's vital. And when we talk about a condition, let's just say high blood pressure. I mean, the first step is about education. So explaining to people what it is and why it's important and why we should do something about it. And then you always start at that social prescription, as you said, Ian. It's a great point. And so I've even got this set up on my system at work where, all right, I'm going to write you a prescription. Here it is. And the prescription might be, I'd like you to exercise 150 minutes a week, 30 minutes a day if you can. I'd like you to try and lose, 5% of your body weight. And then we might then get into talking about, well, here's also a prescription for medication. So it's often not an either or, it's generally something that we would do in combination altogether. One of my favorite prescriptions, which always brings up a chuckle, is that I print out a script and I say, look, I want you to take this home and ask your wife or your husband to fill it for you as soon as possible. And on the script, it says, I prescribe you 2 weeks on an island holiday and lying in a hammock reading a book. And I want you to fill it. You must get this one. It's crucial.
I'm sure they'd be jumping at that one, wouldn't they? Yes. Now, just going back to some practical suggestions and habits, and you mentioned earlier about being organized for regular visits. My final question really is what practical habits can men adopt to prevent major health issues later in life? What can they put in place?
Yeah, so I think certainly for younger men and women in their 20s and 30s, I think that really is a time of setting up the habits in life that you need. Most of the time, 20s and 30-year-olds, we're seeing them for actual discrete issues, much more than preventative strategies, but it's still a great opportunity for us to speak into their lives for healthy things. So setting up healthy diet, healthy nutrition, healthy eating, healthy drinking, minimizing alcohol, avoiding smoking, remaining physically fit and active and a good weight. So they're probably the building blocks. Once you get to about the 40s, and certainly absolutely the golden age for prevention from the age of 50, it's really about that once a year checkup minimum, where we would be attending to those three major areas. So your heart disease risk factors, your stroke risk factors, and um, uh, cancer risk factors, and how we can address or screen for those more common cancers. And as well as that, getting a feel from the patient, or even directly asking the patient about mental health matters. So 50 onwards, they're the habits that are really important to have: that regular connection with a GP that you know and trust, that you've been through a lot of things with, that you feel that you can just be as honest as possible with, but also someone who you are accountable to. And so, that's not just your family and your friends, but that's also your medical practitioner. And there's all these programs that we put in place for men's health checks or women's health checks or over 75 health assessments. There's a whole range of different things that you can access as well.
Well, Dr. Peter Lovass, who's the principal practitioner at the Blackburn Clinic here in Melbourne, I know you've come in early and you're at the clinic already to be able to come and share your insights and thoughts with regard to men's health. We do appreciate it very much. And thank you for being our guest here at Monday Matters this morning.
Thank you, Ian, and thank you to everybody for having me. Appreciate it.